These are, very explosive, fast-happening attacks, and you need a very strong, fast-acting medication or treatment for them. One of the best treatments is inhaled oxygen. Actually works quite well, and it's very safe. Another treatment would be an injection of medication such as sumatriptan, which is it's in the class of medications called triptans, used for both cluster and migraine. Sometimes patients can benefit from a nasal spray, but generally an oral medication is too slow and not powerful enough. One would hope. Not all general practitioners are well versed in diagnosing and managing headache disorders, but this is changing. We at the American Academy of Neurology and the American Headache Society are making great efforts to better educate others out there about how to recognize, diagnose, and manage these headache problems. We always like to emphasize how disabling headache disorders can be, particularly when you think about migraine. It affects women more often than men, 3 times as much. I said that 12% of Americans have migraine. It's 18% for women and 6% for men. And most of these women are in the prime of their lives. It tends to peak in the ages of childbearing potential and child rearing, and also starting careers and advancing in careers. And headaches can be so debilitating that they take all that away from a person, be they a man or a woman. It's a lot of factors, a lot of different factors. I mean, stress can affect any medical condition, especially a neurologic condition. And we do see a lot of interplay between stress and mood and anxiety and headache disorders. Probably a bit more so for migraine than cluster, but it's true for both. We're learning more all the time. Thankfully, more attention has been paid to the need for greater funding for research to better understand these complex disorders, but we're still falling quite short. We have very few FDA-approved treatments for headaches. Most of what we do is borrowing from other disciplines and just blind luck. A lot of the treatments that we utilize were discovered to be helpful just by chance. But this has fueled more inquiry into why these treatments work. Why should a blood pressure medication help migraines, for example? So we're learning more and more about what actually happens in the brain to cause these attacks. And the more we understand, the better we can target our treatments. Absolutely, and that's something that we struggle with all the time. The stigma for patients with headache is pretty great. This has been studied. In fact, my colleague, Dr. William Young, has published on this. And there's not only a stigma among migraine patients, but also those who treat them. But this is all changing too, we're happy to say. You have to improve awareness, and the field itself is becoming more respected and recognized as a real scientific basis for all the things that we do.